Hey there, so in this video we are just going to briefly chat about respiratory acidosis and respiratory alkalosis. So first off, starting with respiratory acidosis, the important thing to realize is that acidosis is going to be caused by an increase in the PaCO2. So a normal PaCO2 is going to be 35 to 45, and as that CO2 increases, the pH is going to decrease, because remember that an increase in the CO2 is going to cause some acidosis, and an acidotic pH is going to be below 7.35. So you're going to expect a pH below 7.35 in this scenario. And you're also going to expect a CO2 greater than 45. Now this may be not necessarily greater than 45, but higher than their baseline. So maybe someone lives with a CO2 of 35, and in this scenario it's going to be more like 42, 43, 44. Could be much higher than that depending on what's going on with the patient. The causes of respiratory acidosis are obviously, as it sounds, respiratory in nature. So an acute scenario can include an airway obstruction, where a patient's unable to exchange air. Could be pneumonia, where there's issues with ventilation and oxygenation. Could be asthma, where the patient's having difficulty exhaling anything. Could be a chest injury or pulmonary edema. Both, again, could be issues with ventilation and oxygenation. Chronically, you're going to see patients with COPD and emphysema live with a higher PaCO2. Like I mentioned earlier, maybe the normal patient with just an airway obstruction comes in with a 35 baseline PaCO2, but then because of the obstruction, it's elevated to 48, and then that's going to decrease their pH. Whereas a person who lives with COPD or emphysema is most likely going to have a higher baseline PaCO2, so then they may have some compensation factors. So with these COPD and emphysema patients, you may see that they have a CO2 of 48, but then a normal pH. So that's something to consider depending on the patient's history. And with these patients, you want to just be careful about O2 administration. There is records of the alteration of the respiratory center for these patients, so that when you actually administer oxygen, you can cause them to stop breathing. So for that purpose, we usually provide oxygen for these patients to a goal saturation anywhere from 88 to 92. Typically in my practice, I like to stay around 90 for these patients if they do require oxygen. Respiratory acidosis signs and symptoms are going to be respiratory in nature, so patient's going to have difficulty breathing or dyspnea. They have an increased work of breathing. They may be dizzy or restless or have a change in mental status. And the treatment for respiratory acidosis is going to be to improve that ventilation. So whether that's to clear the obstruction or administer bronchodilators, or maybe they need BiPAP or CPAP or an endotracheal tube, depending on how emergent it is. Or maybe it's just postural changes depending on what's going on with the patient. So in synopsis, for these respiratory acidosis scenarios, you're going to see a decrease in pH and an increase in CO2. On the other hand, we can talk about respiratory alkalosis, which is basically just the opposite. So you're going to have not enough CO2, which is then going to cause the pH to rise because there's not a high CO2 level, and then it's going to be more alkalotic blood, which will be a pH above 7.45 typically. And this is going to be caused by hyperventilation, right? Because you're breathing real quick. That's going to get that CO2 out, and CO2 levels drop, and then again it's going to raise the pH. This can be caused by anxiety, pain, hypoxia. Just think about it. If you are in any of those scenarios, then you're going to be breathing faster and breathing out CO2. Can also be caused by an aspirin overdose, which is not something you're going to see every day, but that does stimulate the respiratory center, so that's going to again cause some tachypnea or an increased respiratory rate, and can decrease the CO2. Signs and symptoms are going to kind of be similar, so it really depends on what's going on with your patient to help you determine what's going on, whether it's acidosis or alkalosis. You may still see some dizziness, you may see some tingling in the fingertips or pallor around the mouth if they are experiencing some respiratory alkalosis. The treatment for this, respiratory alkalosis, is going to be to slow the breathing, whether that's a sedative or just coaching them. You can also have them rebreathe. If you see someone in the movies or something use a brown paper bag, what they're doing is they're hyperventilating, so they're breathing out a lot of CO2, but then that CO2 is getting captured in the bag and they're breathing some of that back in, which then helps to normalize their CO2 levels. So just in synopsis for respiratory alkalosis, the hyperventilation is going to cause a decrease in the CO2, which then corresponds to a rise in the pH. If you have any questions, then feel free to reach out in the comments below, and we'll be more than happy to get to them when we get a chance. We look forward to helping you. Have a good one.